What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for the viruses. It is time now for the Thursday edition of the Virus Update for Thursday, June 12th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and there's not enough news coverage of what's going on with these viruses. That's where I come into play. I give you the latest news, data, wastewater, and anything I can find on these viruses and some other health-related risk as well to keep you safe and informed of what's going on. Want to stay informed? Subscribe down below. If you like today's video, give it a thumbs up. Let's try for 175 like button hits today. Of course, share this video with anyone you know and leave your comments down below. Already, we do have several things to get through today. Unfortunately, we may not get to New York State. I don't know. They haven't updated yet. They've been updating later, and I'm kind of on a schedule where I can't wait till later. So we'll see. We'll refresh it as we go along. And we're also going to do an unboxing today, something we have not done here on the channel. And it's been it's been a very long time, but got to unbox a package that I was expecting in the mail yesterday, and it did come, actually from Amazon. All right, many COVID patients need 9 months to remain baseline, or to regain baseline well-being, study suggests. So, what I'm trying to say here is, many patients, it's taking at least 9 months to go back to the way they were feeling before they had COVID, and well, for many people, as we know, they go on to not go back. But yeah, this is really significant. It took many U.S. COVID-19 survivors who sought treatment for their infection up to 9 months post-infection to return to their baseline sense of mental well-being. 1 in 5 still had suboptimal quality of life at 1 year. And this is coming from the Innovative Support for Patients with SARS-CoV-2 Infections Registry. And we come down to this in bold print. The finding shows that healthcare professionals need to pay more attention to their patients' mental well-being after a COVID-19 infection and provide more resources that will help improve the mental health in addition to their physical health. Yikes, up to 9 months. But you know what? This should not be a surprise. There's a lot of people out there that, they have these new issues afterwards. And you know what? That does impact your mental health. Just the whole process of testing positive, the acute phase, the initial, you get sick. I mean, that has an impact on your mental health. I know when I had it back in December into the first month of this year, right away my mental health was like, oh, no, I've tested positive for COVID. Like, shoot, I've been trying so hard to avoid this. A lot of people probably don't feel that way because they're like, oh, COVID's still a thing? Guess I got COVID, blah, blah, blah. Oh, well, this will be no big deal. Some of them were surprised when many weeks later, they're still dealing with problems. All right, moving on because we have a lot to get through. All right, this is a study. We're just going to read the headline. Anything you see here will be in a thread. This I already put in the archive of studies on my website, datareport.info. I did it just a little earlier. And severe forms of COVID-19 infections in children may increase cardiovascular disease risk. Yeah, yet again, another thing on children. We're finding out so many things that COVID can do in children. And yet, back in the early days of the pandemic, kids don't get COVID bad, but keep your kids away from their grandparents. It's not safe for our elderly population. Hello, it's not safe for kids to get COVID either. Want to read the full study? I've tweeted it out. I've posted it in my archive. It's in the children's section where, COVID in kids, and you can check that out. All right, some things from Dennis the COVID info guy. New South Wales respiratory surveillance reports week ending June 7th, 2025. COVID positivity rate, 7.1%. That is up by 1.1%. Number of laboratories reporting COVID, 3 out of 4. COVID cases, they're still rising here. Unlike another region, was it the Queensland that we talked about? There was another region we talked about the other day where COVID wasn't rising. Anywho, 3,154 new cases. That's up by 15.1%. Influenza, 3,135. That's up by 10.6%. RSV is actually dropping. 3,141 cases, down by 3.9%. New South Wales, when it comes to sequencing, updated May 31st, a little behind. NB.1.8.1 at 38%, XEC 20%, LP.8.1 at 14%, KP.3 is at 10%, and JN.1 is now at 5%. And it also looks like, for the most part, except for Liverpool, everything is rising when it comes to COVID in this week's update for wastewater. All right, Taiwan, get this. They said a rise in mask wearing has been a major factor in slowing the spread of virus, meaning the COVID virus. From June 1st to June 7th, there were 70,182 outpatient and emergency visits for COVID, a 9.3% increase. Now, we talked about this earlier in the week, but they're saying it is slowing the spread, which this leads me to today's little package opening. And you can see here, it's a pretty big box. Let me back up for a second. And matter of fact, since we're going to look at this, let's make me full screen for a moment. And you might know what I'm leading up to here, since we just talked about the M word a moment ago, mask. And that is, I got a new shipment in of masks today, just in time for the summer wave. My previous shipment, I was down to like my last mask, so it's time for new mask. N95, this is a 95 respirator by Honeywell. And this one is the DF300N95. I'm pretty sure I have used this before. I tried to buy the same thing that I bought last time. I think it on Amazon was only like 16 or 17 bucks. I was surprised because it was like over 30 bucks last time. And some of the reviews do say that sometimes the straps break. I've had that happen with one or two of them, but for the most part, I have been okay. And this is a box of 50, so this should last me a little while. And yeah, that's my little unboxing for today. We did get masks just in time for the summer wave. I got some things coming up that masking will be required. Of course, as you know, in July, I will be going up to visit relatives in Maine, but I'm actually going to be seeing them before then. We have a function coming up upstate at our place in, I guess you could call it, yeah, central Pennsylvania. It's coming up not this week and the following weekend. Don't worry, the virus update is continuing. You've seen me do virus updates there before. We actually did walks out in the wild. Won't be doing that this time because it's rattlesnake season. Don't want to risk getting bit by a rattlesnake. But we will continue updates there that week, and I'll inform you on that as we head into next week. All right, continuing on here. Health officials confirmed new measles cases in Twin Cities metro area. New cases highlight urgent need for continued vaccination and awareness around measles. So, yes, there are new. I thought I had more to the story. The point is, you get the idea here. Minnesota is reporting more cases of measles. Southwest Kansas reports more measles cases among unvaccinated children. In outbreak, I believe it is 5 new cases. Yes, 5 new measles cases in Southwest Kansas. All appear to be unvaccinated children. This is a theme we're seeing again and again and again. Yes, there have been a few fully vaccinated cases or one-dose vaccinated cases, but the majority of the cases in the United States have been unvaccinated or unknown status. The Kansas outbreak has reached 74 cases across 9 counties, plus 2 cases separate from the outbreak, whatever that's supposed to mean. We'll get a nationwide update tomorrow. We did just get an update today. We'll get to that in a moment. First off, India. COVID-19 cases in India. Yeah, active cases are over 7,000 now. To be exact, 7,154. And now moving to, I believe, Ontario. Yes, number of new outbreak-related measles cases falls again in Ontario. So it still went up, but the number did not go up as much. This is some good news. Ontario reported fewer new measles cases over the past week than in recent weeks. However, much of the growth was concentrated in a few communities. Public Health Ontario's latest measles update released June 12th shows 74 new cases. That is a number that's not going up as fast. Were reported during the past week, all connected to a multi-jurisdictional travel related outbreak. This brings Ontario's outbreak-related total since October 18th to 2,083, 1,795 confirmed, and 288 probable cases. That's a big number. That's not a good number. All right, UK did update today, but we got a few things here that may or may not make sense. First off, cases. They went up again. 1,211, and I've showed this a lot lately. A lot of cases over there are not caught because of these at-home tests, or just simply people not testing. And that is up by 78, or 6.9%. Deaths, 63, that's down by 9. It says patients admitted in healthcare. Now, the number showing May 31st, that is, I don't know if that's correct or not. And it's saying it's up. Well, I recall it being higher than 947. I thought it was above 1,000 last. Maybe I'm wrong. Anywho, it says up by 81, and that's a 9.4% increase. If anyone wants to go back to last Thursday's video and see what number I read off of there, by all means, go and do it. I thought it was 1,000 something, but hey, I could be wrong. Take a look at this testing. Yeah, 5.8% positivity rate. But if we come down here, if we come all the way down here, take a look. It's actually up to 6.3% now. So the positivity rate continues to go up in the UK. We'll take a look at some other things from the UK over the weekend. My website is datareport.info. Let's refresh this. I do want to show you something on here real quickly, if this does refresh. Anywho, the point, yeah, there we go. Here's that study we talked about earlier, and I did post in here. It looks like there was another post made in there. And you can just click on that link, and it'll take you right to that study by Medical Express. All right, taking a look at air qualities. This is not good, and in some places, air qualities are a problem today. We do have air quality alerts here in my area. It is an ozone alert day. In fact, I think I may show you that when I show you the Philadelphia EMS total. I think that's listed within it today. I'll show you. And you can see here, yeah, same general suspects. Wherever that wildfire smoke is, straight on in through the Great Lakes, the Midwest, into the Mid-Atlantic, and into the Northeast. We're dealing with bad air qualities again. Now, some of these areas in the Mid-Atlantic, there may be a wind shift over the next couple days. There's a little upper-level low system down here that's going to come up here, maybe get hung up along a boundary. That may shift our wind to the southwest, but I don't know if it's going to fully clear us of the smoke, at least in the middle. I don't know. We'll have to see what happens. It may still be an issue because, I don't know, this smoke gets pretty high up, but again, we're just still dealing with bad air quality levels. And yes, even down here in southern California, there's a problem as well. Taking a look at what's going on in Canada, let's refresh this. Did this update yet? COVID-19 is moderate, flu A is low, flu B is low, and RSV is low at this time. All right, skipping over bird migration. I think we're done with bird migration for the season, so I'm going to probably be removing that tab. Taking a look here what's going on when it comes to grass pollen, and we can see here, it's still pretty high in the east, but even higher in the central plains and onto the west coast. Yeah, it's a problem, but you can see way up there in the portions of the northeast and northern Great Lakes, still not terrible just yet. It'll get bad there soon, and tree pollen continues to lift north because the budding of the trees is completing its process in the south because, well, now you're essentially entering your summer climate. I know we're doing it here, and I'm looking at my weather station. Yikes, it's saying it's 91 degrees outside right now here in Philly. So, yeah, we're completing the process as well. Breathing index map. I have to show this again. I just showed you the bad air qualities, really from Iowa to Chicago, through portions of Ohio, down into the Mid-Atlantic region. Very poor breathing today. I'm going to definitely make sure I take my dose of my inhaler before I go out to work this afternoon and evening. And even some spotty issues on the West Coast as well. Not terrible in the Southeast. Could be better in some of these places, but overall it is not bad down there. It's the North that is dealing with the problems. All right, taking a look at what's going on in Pinellas County, Florida. And we do see here, we do have some calls. Just general mix of calls going on right now. Philadelphia had 801 EMS incidents on Wednesday, June 11th. And yes, this is from the fire department. And they did retweet or repost Philadelphia Public Health. They put today, breaking. Today, June 12th, 2025, has been declared a Code Orange Ozone Action Day in Philadelphia. Protect your health during air quality action days, limiting strenuous outdoor activities. Yeah, if you don't need to go outdoor, this is not, of course, the alerts for Philadelphia, but I'm extending this to anyone who lives in the areas that I just showed you, the poor air qualities. If you don't need to go outside today, don't. That includes all these places that are in this bad breathing index level as well. Please limit your time outside today. And you know what? If you are somewhere where you have to go outside today, chances are you're getting a little thirsty, aren't you? Yeah. I mean for water, not alcohol. Or lemon water, or whatever you choose to drink. Something that will keep you hydrated. Let's pause and take that hydration break, shall we? Alrighty. Doesn't that feel better? Alright, taking a look at what's going on outside of Philadelphia, Montgomery County. Few calls right now. Not terribly busy. I'm seeing stroke. Yikes, that's not too far away. I'll be in that area just a little bit from now. Taking a look at what's going on in Chester County, Pennsylvania, and we do see various different things. Cardiac arrest is showing up in East Nottingham Township. One that says Burns. Okay, that's not good, but yeah, as you can see here, just a general mixture of calls at this time. The hospital situation today is, continues to be problems in southeast Pennsylvania. A couple problems up in northeast Pennsylvania as well. The Lehigh Valley. How about south central Pennsylvania? Well, we started the week there with problems. None there today, so that is good news. All right, let's take a look at New Jersey. There have been several hospitals dealing with issues there today. Cooper University Hospital, full, and looks like a divert going on. They're still accepting trauma, stroke, and STEMI. Looks like Inspira Center, Mullica Hill, is dealing with a critical care. No beds for that. Okay. Jefferson Stafford Hospital is on a specialty issue. Psychiatric issue at University Hospital. We see that happen a lot there. And New Jersey did update, so let's take a look at that real quickly. Emergency department visits and hospital admissions remain low for COVID-19, influenza, and RSV. Recent COVID-19, influenza, and RSV hospitalizations have mostly been reported in persons 65 years and older. 5 fatal influenza-associated pediatric cases have been reported this season. Test positivity remains elevated for some of the viruses. Levels of COVID-19, influenza type A, type B, and RSV and wastewater is low. The predominant variant is still the LP.8.1, a subvariant of Omicron, covered by the 2024-2025 COVID-19 vaccinations. Already, and respiratory outbreaks there by K-12 schools have primarily been due to influenza. Current outbreaks are in long-term care facilities, primarily due to COVID-19. Last week they said their ER visits were going up a little bit. They're not saying that this week, so maybe that is not the case anymore. All right, let's refresh and see if New York State has updated yet. I have been waiting for this. No, still showing the same number from yesterday, so sorry, I can't show you anything more from New York State. I can show you Washington, and we'll take a look at wastewater there. And for the most part, Washington State is doing okay. We do see just to the north of Seattle a little bit more of some increases starting to show up there, a few of them, so that's something we will have to keep an eye on. I do have 2 wastewater sites I wanted to look at today. There was a change with wastewater scale. Let's go to that nationwide map first. We can see here, the West Coast, it's now listed at high. Let's take a look at that. And in the West Coast, we can see here, it's high, and I don't know why it's saying high, because that level there, that reading, that value, is not all that high. I don't understand it. I'm not going to try and understand it, but I do have written down here, we need to take a look at San Francisco, Oceanside, so the more west wastewater site. Why do I have that written down? Well, take a look at this. You can see here, it's a little bit of an increase on the most recent update when it comes to COVID. They are listed at medium. We'll have to see if that increase continues. Looks like maybe it's trying to plateau or level off. And take a look here. Everything else is, for the most part, okay at this point. And also, we need to go to Akron, Ohio. And then we have some data from CJS, and that's where we will end today's video. We can see here, in Akron, Ohio, levels are listed at high at this time. And we can see here, COVID, it is increasing. Now, we will get an update from Ohio. It's going to come in actually in about 20 minutes. I'll make sure I get that in either tomorrow's video or at some point over the weekend. But COVID there was increasing a little bit. Everything else, for the most part, is okay. HMPV is still listed high, and norovirus is still medium, but we're not seeing big increases on these charts at this time. All right, let's take a look at some data now from CJS, and we can see here that on Tuesday, the daily number from New York was 336 cases, Puerto Rico, 481 new cases, and 14 new deaths. I wonder if that's a multi-death day death total. Could be. Maryland, 352 new cases and 2 new deaths. Virginia, 772 new positive tests and 23 deaths added by the CDC data tracker last Friday. 12 of those were 2023 deaths that had been removed from counts on May 16th, but were restored to the counts last Friday. Florida, 2-day update, 1,267 new cases. Yikes, that's a lot. And 8 new deaths. New York, 301 new cases. Puerto Rico, daily number, 481 new cases again. Odd, they had the same number 2 days in a row. Michigan, 470 new cases and 31 new deaths, including 1 from 2020, 2 from 2023, and 9 from 2024, mainly late July to early September of that year. Oregon, the positivity rate is 5.1% for COVID for the last week of May, and 6 new deaths. South Dakota, monthly number, 179 new cases reported over the past 4 weeks, and 5 new deaths added. And Washington, weekly, 337 emergency department visits and 11 new deaths. Alrighty, folks, that does it for today's virus update. If you like today's update, give it a thumbs up, subscribe down below, hit that notification bell, and of course, share this video with anyone you know. Leave your comments down below, and ways to support the channel are listed down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.